Hi everyone, my name is Coach Martinez, and I'm honored to be speaking in front of these amazing coaches at this wonderful convention. And as you guys know, I'm the Long Beach City College soccer coach, and I've been a coach for around 10 years. And there's this ongoing epidemic of ankle injuries, more specifically ankle sprain injuries. And I want to talk a little bit about how we as coaches can help out with this situation. So let's begin. So according to data from a NCAA injury surveillance program, it indicated that ankle injuries are the most common injuries amongst college soccer players. And a report from 2004 to 2005 and even going on as to 2013 and 2014 indicated that there were around 2,068 ankle injuries that occurred for every 1 million athlete exposures, which roughly equals around 1.5 ankle injuries for every 1,000 athletes. And three of the most common ankle injuries include inversion ankle sprains, eversion ankle sprains, and high ankle sprains. Each of these injuries can be prevented with the right tools and the right knowledge, and by following certain procedures, they can also be treated easily. I want to talk a little bit more about the types of ankle sprains that there are. Inversion ankle sprains are the most common, as they refer to the inward rotation of the anterior ligament. They also, people like calling them rolling your ankle inwards. And it's one of the most common ankle injuries amongst athletes, not just soccer players, but also in basketball or even football. And next, a type of ankle sprain are eversion ankle sprains, which account for at least 5 to 10% of ankle sprains. They refer to the outward rotation of the deltoid ligament, the outward rotation causing the tear. High ankle sprains referred to as any ankle sprain above the ankle joint. And next, I want to talk about that college athletes are not the only ones that are susceptible to this. There's also many professional athletes that have succumbed to this type of injury. Like in this example, we see an inversion rotation. He stepped wrong and he rolled his ankle like this, rolled his ankle inward. He caused that tear in the ligament. And it's also caused by contact, as we see in this example. We see the player getting hit in the ankle area, causing another inward inversion rotation. Each of these can be prevented. And I want to talk a bit about the ankle severity injuries, the severity of these injuries. They're classified into 3 grades. Grade 1 is referred to as a mild pain. There's mild tenderness. It's a light tear of the ligament. There's no actual visible tear on it. And you're still able to walk fine with this type of grade injury. And the second, grade 2 ankle sprains, a popping and tearing can be heard. It's a little bit more severe as it comes with bruising and swelling. It's not a complete tear yet, but it's still very painful and difficult to walk on. And the last, the grade 3 ankle sprain is one of the most severe, as it is the complete tear of the ligaments, causing extreme bruising and swelling. And it also, the ankle is not also able to bear the person's weight, so walking is not an option on it, as it can lead to further injuries, and certain precautions must be taken. And now I'm going to talk about how we can prevent these types of injuries. So simply including a stretching regimen before and after practice will be enough to prevent any kind of injury, any kind of ankle injury, whether that's like calf stretches or even using even dynamic stretching or static stretching can help. Strengthening the ankle joint with certain exercises such as like Bosu ball balances or uneven boards or even rocker boards can help out with this. And choosing the right kind of shoe can also help out too, as many athletes like to use different types of shoes, and sometimes their shoes can get worn out, and sort of cause injuries, be more prone to injuries. And this example, we can see soccer cleats. There's custom made ones with ankle supports. They can help out from not prevent inversion and eversion of the ankle. And these are quite comfortable as I've trained in these myself. And simply choosing the right shoe is enough to prevent these. And let's talk about what would happen if you were to get one of these injuries, an ankle sprain. So the first thing you must do is apply the Rice method, which means rest. Rest on that area. Don't put that much pressure on it. Don't stand on it. Put ice on it immediately. Compressing the area, keeping it nice and tight with ankle tape or some sort of a prosthetic. Keeping the ankle elevated will be enough to reduce swelling. There's also manual therapy is an option too, as it can increase the mobility of the injured joint. And flexibility exercises can also help increase the overall flexibility of the ankle ligaments. You can use resistance bands, even a towel. And even foam rollers can also help out increase the overall flexibility. And it's also very important that an athlete gets around to 80 to 90% of their normal ankle strength before returning to high intensity training, as returning too soon can result into worsening the injury and causing more and more pain and causing them to miss out on more games. And I hope you guys understand a little bit more about these injuries and ways that we can help prevent it. Thank you.